unless you've been hiding under a rock, I'm sure you heard of Ozempic, the end-all, be-all drug when it comes to managing weight loss. Now, this drug was originally used for type 2 diabetes, but we have seen so many effects when it comes to weight loss with using Ozempic. In fact, celebrities everywhere are using Ozempic to get slim and trim and to look good. Just inject yourself with a drug and then boom, you have no appetite, everything sounds hunky-dory. Not so fast, because Ozempic does have its own side effects. Now, most of the side effects are not serious, but you should be aware of what they are and how to manage those. In today's video, I'll discuss the side effects you need to be aware of when it comes to Ozempic. We'll discuss the most common side effects, the most serious side effects, and we'll talk about exactly how to minimize some of these side effects so you can take this medication and hopefully not have some of the issues that can occur with that. Guys, let's talk about poop. Now, before we start, do me a favor. Don't forget to hit that like, share, and subscribe so you can get more videos on topics just like this. So howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. Can see yourself a gastro for all your GI needs. So let's talk about the most common side effects that I see in patients who have Ozempic. The first one being nausea and vomiting. So what Ozempic does is it actually slows down your gut. And so it introduces a condition called gastroparesis, which is delayed gastric emptying. Now, gastroparesis is a real condition that we see commonly in the GI tract, most commonly from type 2 diabetes. But Ozempic, because it slows things down, it slows down the contraction of your stomach, meaning food sits in there longer and more often, causing nausea and vomiting as a side effect from that. It's the most common side effect that I see in my patients who take Ozempic. Now, the good thing about this side effect is that it does go away over time. So sometimes a tincture of time is all you need. But there are things that you can do to hopefully make this issue a lot easier for you to handle. Number one, take small frequent meals. Small frequent meals throughout the day is much better for your gut if you have this side effect, as opposed to taking very large 3 meals per day. Number two, low fiber diet. Fiber can make things stay longer inside your gut to make these symptoms worse. So contrary to all my other recommendations, this may be one of the very few times I want you on a low fiber diet. Number three, stay upright after you eat. If you lie down or sit down after you eat, that'll cause your symptoms to get worse and make it more difficult to digest. And then lastly, we may want to give you a medication called metoclopramide or Reglan, which can actually help out with the contraction of your gut that make things pass through easier in your stomach. Now, another common side effect is diarrhea, and this actually occurs with much higher doses of these medications. Once again, reassuringly, this side effect does go away over time. However, there are things that you can do to minimize these symptoms. Try to minimize the foods that can cause diarrhea. Processed foods, spicy foods, dairy foods. This very commonly can make diarrhea symptoms worse. Number two, try to minimize caffeinated drinks. Caffeine not only acts as a stimulus for your brain, but it can actually act as a stimulus for your gut as well. It moves things through faster and quicker. It jolts up your gut to wake it up to give you more diarrhea. So try to minimize on that coffee and those teas. And don't forget to drink plenty of water and stay hydrated, especially if you're having a lot of diarrhea. And then lastly, taking things like Imodium can really slow things down to make it easier for you to not have this side effect. Now, another side effect is on the other spectrum, constipation. Once again, these medications slow things down. And when your colon is slow, guess what happens? You get constipated. Now, once again, this should improve over time, but if it doesn't, there are things that you can do. Number one, consider adding magnesium in your food, in your diet, or taking a supplement. Now, always keep in mind, speak to your doctor before we do this, that magnesium can help you use the restroom easier and more often. Consider adding Miralax. 1 scoop of Miralax every single day can get your bowels going and flowing. It is very safe to take long term, and typically there are not long term side effects with you taking dairy Miralax. Number three, simple things will work. Drinking water, exercising, having regular toilet time. These are simple, but actually do work to get your better bowel movement. Another common side effect is actual stomach pain. It actually can hurt inside your belly. Your stomach is not used to the change that occurs whenever you take Ozempic, whether it's slowing things down or speeding things up. Now, usually it's not serious, and in most cases, typically is mild. On the occasional basis, there is that person in which the pain can become so severe that they have to go to the emergency room. And if you have severe pain, don't ignore it. Speak to your doctor to find out exactly what's going on. But if it's mild pain, maybe taking an acid-reducing medication will help out. Peppermint, chamomile tea, these things help to soothe your gut to get you feeling better. An over-the-counter supplement called IB Guard or FD Guard is very effective effective to release the natural herbs to help out with your GI tract as well. Next is gassing and burping, another common side effect. Once again, it goes down along the lines of slowing down your GI tract. So as you slow things down, things will ferment in your stomach to produce gas, burping, bloating, and symptoms like that. Things you can do to help out: try to minimize those foods that are known to cause these issues. So carbonated drinks, it's like Captain Obvious here, but you know if you're having gas and burping, don't add more gas by drinking a substance that has a lot of bubbles in it. It makes common sense, but you'd be surprised how many people forget that. Number 2, minimize or eliminate dairy products. This is a very common trigger when it comes to gas issues. Number 3, remove artificial sweeteners. These have certain sugars in them that are difficult to digest, that can sit in your stomach and cause gas and bloating to occur. Consider eating slower and not having these huge meals. Slower eating will minimize what's called aerophagia, or actually swallowing airs. And once again, be careful of having too much fiber, because that can cause gas and bloating to occur as well. If you have a lot of issues with this, try doing peppermint tea, chamomile tea, or even another herbal medication called ibuprofen, which can really help out when it comes to gas and bloating. Now, most of these side effects are pretty harmless, and they go away in the long run. However, there are some serious complications you need to be aware of that can occur that do need medical attention. One is pancreatitis. So pancreatitis is when you have inflammation of your pancreas, which is an organ right in the middle of your abdomen. This can cause severe pain that actually radiates to your back. So if you have this, number 1, stop your Ozempic, and number 2, talk to your doctor about what is going on, because this can lead to serious complications down the road. Along the same lines are gallbladder issues. Your gallbladder is an organ that's on the right side of your abdomen, in the right upper quadrant, and sometimes Ozempic can cause your gallbladder to act up and go crazy and cause symptoms to occur. This will present as pain in the right side that can go to your back as well. Once again, if you're developing these issues while on Ozempic, stop your Ozempic and go see your doctor to see exactly what is going on in that gallbladder. Number 3 is gastroparesis, or delayed emptying. Now, I talked about this briefly. Let's go into more details. So gastroparesis is a condition in which your GI tract slows down. This is exactly what Ozempic does. You see this commonly in diabetic patients. And if you have diabetes and you take Ozempic, you may be having a double whammy when it comes to developing gastroparesis. So patients will present with nausea and vomiting typically after they eat, because things are slowing down in your stomach. You're not moving digestion down. It just sits in your stomach, and it causes severe pain, bloating, nausea, and you don't feel very, very good. This is a very common side effect with Ozempic, but like I mentioned before, you can do things to help out with this, whether it's changing your diet or maybe taking some medications on top of this. Now, as scary as these side effects sound, keep in mind Ozempic typically is a pretty safe medication. However, it's important to recognize them so you can stop the Ozempic and go talk to your doctor about what the next steps are to get you feeling better. Now, there are a couple things I want to recommend just in the end of things to avoid when you're taking this medication to minimize these side effects and to get you maximal weight loss. There are foods I don't want you to have. Fried foods are terrible for your gut, terrible when you're on Ozempic, and can make these symptoms worse. Don't have a lot of foods that have a lot of oil in them, that are greasy and difficult to digest. Number 2, avoid red meat. Red meat can sit in your gut and make things so much more terrible, make it harder to control your symptoms, can actually lead to weight gain as well. Next is alcohol. Alcohol's terrible. Don't do it. And alcohol side effects when you're on Ozempic can make things worse for you. It sits in your stomach, worsening acid reflux, cause you to have cancer in your esophagus. It can make your pancreas worse. It can destroy your gallbladder. It is not good for you. So eliminate or try to minimize alcohol use when you're on Ozempic. And certainly, sugary beverages. I feel like I shouldn't have to tell you this, but if you're trying to lose weight, don't drink something that's gonna make you gain weight. Come on, guys, you know this. So avoid those sugary beverages so you can get the best effect from Ozempic. And then lastly, have patience. This is the biggest thing you need to do whenever it comes to weight loss. Weight loss is a journey. It's a marathon. It's not a sprint. Have patience and incorporate the lifestyle changes that you can do to help you lose weight. Exercise. Eat right. Minimize calories. These things work. And if you do this on top of taking Ozempic, you will feel better and we can maximize your weight loss as well. As always, be sure to speak to your doctor about the side effects of these medications so we can make sure we address them before they become serious later on. And guys, so thank you for watching. And don't forget to leave me a comment. Let me know what you guys think. Do you have questions about Ozempic and these medications? Did we address them all? What other questions do you have? Comment down below. I would love to hear what you guys have to say. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter. Let's talk about poop.